Hello, everyone. So just getting started, I didn't set out to go into women's health. When I was in my graduate studies, I wanted to be an orthopedic physical therapist. But during one of my rotations, I was required to see women's health patients with my instructor. My very first women's health patient was a young individual who was ready to start her family, but it wasn't happening. So she started having those conversations that many do when it's not happening. She was going from doctor to doctor, referral to referral, and landed in IVF. But no one was asking her why it wasn't happening. You see, for her, she was having severe pain during intimacy. So her doctor referred her to physical therapy in order to support herself through pregnancy. But that's not where we started. We started with her pain. And on her final discharge day, she told us that she was pregnant naturally. When she was getting emotional, my instructor was getting emotional, I realized I was getting emotional. And I realized that I wasn't in the right specialty, but rather I had found my right one. And these are stories that I want to highlight that are starting to get brought forward. In women's health, we have women going through these different transitions in their life, through fertility, through pregnancy, the years after, and the long transition that is menopause. And all of these symptoms start popping up, right? We see these new symptoms, evolving symptoms, changing symptoms, and women don't know what's going on. And no one is helping them figure out and make sense of it all, helping them to connect the dots so that they can be making choices to help them through what is arguably one of the hardest transitions in their life. And this is where I feel our industry keeps getting it wrong. When we look at women's health, what do we often build it as? Life stages. Here's a fertility solution over here. Here's a maternity program over there. Let's build a menopause solution over here. Each one is genuinely good at doing that single thing that it's built to do. But what is it asking women to do? It's saying separate yourself. Put yourself in a category. Put yourself in a box. She's a continuous person with a continuous story. And she deserves to be able to have a solution that sees her for that. And let me give you another example. Women are waiting later in life to have kids. Later 30s, early 40s, same window when perimenopause symptoms start happening. So let's take a woman who is trying to conceive, but is now also feeling the symptoms of sleep getting disrupted, her cycle's changing, this new anxiety popped out of nowhere. So does she go to the fertility solution, or does she go to the menopause solution, because perimenopause is the beginning of the menopause transition? So which symptom gets to be addressed? How does she choose how to separate herself, treat one part of herself, and quietly ignore the other half? This is what's costing her. But what is it costing you? Women's health is a $1 trillion economic issue. Employer health costs have rose 6% last year and are anticipated to raise in a similar percentage this year. That's the highest steep that we've seen in about 15 years. Let's narrow in a little bit on menopause. It's the most predictable life transition for women, unfortunately, and yet we have been very slow to put a solution together for them. Women in that working age of 40 to 60, 3/4 of them are experiencing menopause symptoms. It's majority. And 2/3 of them say it affects their work. That costs them about $2 billion in lost productivity, on top of the tens of billions of dollars that it costs in direct medical spend. So when we keep fragmenting care for women's health, two things are for sure to happen, always. First is the finances. So when we look at the finances, we often ignore it until it becomes too large to ignore. So when we put these symptoms that could have been addressed earlier, been cheaper, were smaller to impact, and we say we ignore them, they'll go away, they don't. So let's take pelvic pain, for example. If any of you have experienced anything similar, you know I don't know where to go. Is that my PCP? Is that my OBGYN? So around the system I go, more imaging, more testing, probably surgery. And on the average cost for chronic pelvic pain, surgery is about $30,000. So now you just ended up paying the highest possible price for that condition because it was never addressed earlier. And it shows up on your claims as if it was something new, but it's not. The second is human. Your spreadsheets are never going to show that. But these unaddressed symptoms are affecting women. They're exhausted. They're still dealing with pain, but stop talking about it because they've been ignored too often. They start showing up smaller in their personal life, in their work life. They stop raising their hands for projects. Many do end up leaving the work field completely. And that is because we keep segmenting their care, telling them they need to choose. Do you want to care for this on you, or do you want to care for this on you? But make that choice and separate. So what do we do? How can we address it? This is where AI comes into play, and not in the way people fear. AI is intended to help support in service of the clinician and the patients, bringing that women's health story together in a continuous way. So continuity is the first way we do it. When we can pull those stories together, and I don't have to repeat myself a decade later because it's known what I had already gone through, now I have a quicker route to care. Less appointments, faster action. Our continuity in Bloom shows about a $3,000 just pelvic health only savings per year per member. Then we have pattern recognition. AI can recognize the symptom trends over time. So when we were talking about that disconnected dots and symptoms, that gets pulled together so that individual doesn't have just cluster A symptoms and cluster B symptoms, but it sees it as that person dealing with it, and that care can be covered together. Then we have early detection. And we know, just exactly as that, it's the kindest, cheapest version of care is the earlier one. And lastly is personalization. When we can actually meet women where they are, we can provide them the right care as a clinician, spending my time that's most appropriate for them. When we can actually produce personalization, we see it in the way that they have their quality of life. We see a reduction in productivity, or an improved productivity and productivity loss. But then we also, when we're putting that together, benefits stop competing against each other, right? We have a single connected system that hears her as she is. So as we're moving through that, we need to ask ourselves one question that we had been asking: what stage of life are you in? What point solution can solve that? What we should be asking is, what does she need through her life, and how do we stay there with her? And when we put that together and we have that continuity, employers can see about a 40% increase in savings within the first year for every 10,000 eligible population. I do feel like we're at a turning point. I do feel like we're starting to get traction to do better by women in this way. So when I think back to that first member that I had in the clinic, she didn't need a fertility solution. She didn't need a pain solution. She needed someone to see her, to be there along with her and take her to the end to where she wanted to be. And that's exactly what SWORD is building. At Bloom, we build women's health through the stages of life, following along with her every step of the way so that she's not repeating herself and she's never having to choose what part of herself to treat. We see her for who she is and we stay there alongside her. This is what continuity does. And when we do it differently, then women's health stops paying differently and we start building it correctly. Thank you.